friends, and welcome back to Common Diseases class. In part 2, we are going to look at communicable diseases. That means a disease that is able to be transmitted or passed from one person to another. As we begin, I want for you to look very carefully at this chart of 5 common diseases that are all throughout India. We have coronavirus, which we unfortunately know so well. Malaria, dengue fever, typhoid, and diarrheal diseases. These diseases cause a lot of heartache, misery, suffering, and even death. Now, as we get started in this class, I would like to share with you a short video that talks about pneumonia, but I want for you to focus on some of the important things that are said in this video. So please take careful notes as we watch this together.
Pneumonia is inflammation in your lungs caused by an infection. You have 2 lungs, one on each side of your chest. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon, and when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. If you have pneumonia, your airways or lungs have an infection caused by germs, such as bacteria, viruses, fungi, or parasites. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. Hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you may expel them by coughing. Sometimes germs make it past your mucus and cilia and enter your alveoli. Normally, cells of your immune system attack these germs, which keep them from making you sick. However, if your immune system is weakened due to age, illness, or fatigue, pneumonia-causing germs can overwhelm your immune cells and begin to multiply. Your bronchioles and alveoli become inflamed as your immune system attacks the multiplying germs. The inflammation causes your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs.
I hope this video was very helpful for you. As I said, many people are struggling with pneumonia, and it's very important for us to recognize what this video has said. Did you catch it? Were you paying careful attention? It said that normally our body is able to take care of these foreign substances in our body, whether it's a virus, a bacteria, a fungus, or whatever it may be. If our immune system is strong, our body can take care of this and we will not develop pneumonia. That's very important. So as we think about this particular lecture, remember, we need to do everything that we possibly can to strengthen our natural immune system that God has given to us. And we'll talk briefly about that later in our time together. Now, let's talk about how these different diseases are transmitted, methods of disease transmission. I encourage you to take a careful look at this particular graphic. It's very important. The first 2 that you see here in the methods of disease transmission in red or orange are person to person or droplet transmission. This is very important. We need to recognize that diseases are transmitted directly from person to person. And as number 2 mentions, it can often be through droplets. Every time that we speak, there are droplets that are coming out of our mouth. Especially if we sneeze or we cough, there are multiple hundreds, thousands, millions of particles that are coming out of our mouth and nose. Now, number 3 through 5 that you see in blue, let's look at them carefully. There's fecal oral, there's airborne, and there's fomites. We'll talk about them in a little more detail with some pictures to help us understand. And then number 6, which is a common problem in India, insect bites. These are called vectors, and let's look at those too. So first we have direct contact. Of course, shaking hands or something like that, kissing, those type of things are direct contact and certainly can pass disease. Then look at this picture. Like I said, when a person sneezes, millions of small particles will be going out of a person's mouth and nose at tremendous speeds. That's why it's important to cover our cough or sneeze and make sure that we wash our hands often. Now let's talk about the fecal oral transmission. Unfortunately, right now, there are millions of people around this world who are suffering because of a picture like this. This picture is all too real for many people. You see, what has happened is that because of poor sanitation or a typhoon or some other issue, the bacteria that is often in feces gets into the water supply, and then people drink the water or use it in some way and it gets in through their mouth. This is fecal oral transmission. Then there's airborne transmission. This is another one that is important for us to understand, that it's very good to have clean air. There are particles that can be transmitted just directly in the air, and we need to be thoughtful of that as well. Then there is fomite transmission. If you look at that picture, all of those different things there that you see, the computer keyboard, the cell phone, the tablet, the pen, the other devices there, those that could be used by multiple people, can be excellent transmitters of different types of disease. Some diseases are much more common, and I want you to refer back to that picture that I showed you. In the lower left-hand corner, it showed different kinds of diseases that were transmitted by these fomites. And then vector transmission. I'm sure that many of you have had a disease that has been brought to you by a mosquito. Could be dengue, it could be malaria, it could be chikungunya, it could be a host of other diseases. These vectors are certainly agents of Satan to bring disease and death upon our human race. So keep these things in mind. Do what you can to mitigate these risk factors and also to improve our immune system. How should we do it? Here are 3 things that are very important. Number 1, good community sanitation. Number 2, good personal sanitation. And number 3 is good personal hygiene. Those habits of washing our hands and brushing our teeth and keeping a good, clean, and safe environment for ourselves and our families is very important. So again, my friend, I hope and pray that this information is important. Before we go, there's one more statement. Cleanliness is next to godliness. I would like for you to spend some time in prayer, thinking about what this means. What does it mean to you? What does it mean to your family? What does it mean to your community? Cleanliness is next to godliness. May God bless you.